Hello, we're a team of student researchers under the student-led organization APA Healthcare at UCLA, and today we will be sharing a bit about our case study on prospective telehealth attitudes in the API population of the greater Los Angeles area.
So, what is telehealth? Following the COVID-19 pandemic, telehealth, which is the remote means to health services, has been an increasingly encouraged method of healthcare delivery in the United States. Previous studies have found telehealth to be effective in improving health outcomes of patients with chronic conditions, and there is high patient satisfaction. However, as an emerging practice, telehealth is less used in the API community. The Asian Pacific Islander American community, in particular, faces complex considerations due to both practical and sociocultural factors that could contribute to the underutilization of telehealth. Even amongst the insured API population, there is reduced telehealth usage compared to other groups. Here, we characterize the specific and unique obstacles present in the API community that influence their telehealth utilization and attitudes towards telehealth to better inform advancement.
The participants of this case study were members of the API community in the greater LA area. Follow-up calls were conducted through the HIPAA-compliant Ring Central app, where callers would share a short introduction to what telemedicine is and would then survey the participants on if they had utilized telemedicine in the past and of their prospective attitudes towards telehealth. We hypothesized that participants may face complex underlying factors that impede utilization of telehealth.
Here on the left side, we have our client demographics. On the right, we have our client survey responses. As you can see, around a quarter of all participants reported that they have used telehealth in the past. Around 71% of participants reported that they preferred in-person consultations, and half of the participants reported that they were open to telehealth in the future. Notably, almost 80% of all seniors stated that they preferred in-person consultations, and only 33% said they were receptive to telehealth. In the API population, we see that there is some reluctance to using telehealth and a preference to in-person consultations. This pattern is especially prominent in the elderly population, who we defined as age 65 or above.
As we asked our clients to elaborate on why they responded negatively towards telehealth, we began to see some patterns. 4 clients mentioned an unfamiliarity with internet use, and so telehealth wasn't an option for them, whereas 6 of them had a preference for in-person visits. Our conversations with 3 clients in particular shed some light on why that is. Participants mentioned that they had a distrust towards the accuracy of telehealth, that they didn't think that their doctor would be able to make diagnoses and understand their situation when they're not in person. And so one client even mentioned that if it's dire or important, it needs to be in person. And so there's this concept that since telehealth is inaccurate, it should be used for the sort of less important issues. Lastly, we also saw that COVID-19 increased the client's interest in telehealth. 3 of them indicated that it was safer and that they wanted to use it because of the current pandemic.
In summary, we found that telehealth services are underutilized in the API community. Although around half of our participants were open to using telehealth in the future, this receptiveness declines with age, and some commonly cited concerns include privacy, unfamiliarity with technology, and preference for in-person services.
So here we've characterized prominent barriers to telehealth access in a specific API population of the greater Los Angeles area. And moving forward, focus efforts in advocacy and outreach to promote greater technology familiarity and to communicate the effectiveness and safetiness of telehealth would be especially important to improve the delivery of virtual medical services in the API population. Thank you.